Think for a moment about a child in a hospital bed. Their vulnerability, the potential long-term impact of their care. It just underscores why getting healthcare quality right for kids isn't just important, it's, well, absolutely essential.
Absolutely. And doing that consistently across all kinds of different hospitals and clinics, that's a real challenge. It's complex.
It really is.
You need some kind of framework.
Right.
Guiding principles, and you definitely need organizations focused on driving that improvement.
And that's exactly what we're plunging into today, this whole world of healthcare accreditation and quality improvement, but specifically looking at it through the lens of pediatric care.
A really crucial lens.
Yeah. We've pulled together insights from, the big global players like Joint Commission International, JCI, and the International Society for Quality in Healthcare, that's ICSQA.
Right.
And we've also got perspectives from national bodies like India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Right.
Plus, practical insights from consultancies like QIinPediatrics and, of course, resources focused specifically on improving pediatric care itself.
It's interesting, isn't it, how all these different pieces fit together. You've got the international standard setters, the national bodies, the support on the ground, all aiming for better healthcare.
Exactly. So our mission for this deep dive is pretty straightforward. We want to understand what these organizations actually do, why their work matters so much for keeping patients, especially kids, safe. And we want to pull out the key ideas, the key actions that are really making a difference.
Sounds good. Where should we start? The accreditation landscape itself.
Yeah, let's start there. Accreditation. Why does it even matter? What's the point?
Well, fundamentally, accreditation gives healthcare organizations a structured way to look at themselves, to measure their performance against established benchmarks.
So it's like a roadmap.
Sort of, yeah. It's a commitment, really, a public commitment to a certain standard of quality and safety.
Okay. And leading the charge globally, you mentioned JCI, Joint Commission International.
That's right. They're hugely recognized worldwide for healthcare quality and, maybe even more importantly, patient safety.
Their mission statement really spells it out: to enable and affirm the highest standards of healthcare quality and patient safety for all.
And there's data behind it, too. Studies often show that accredited hospitals, like those with JCI status, tend to have lower rates of certain preventable medical errors, things you really want to avoid.
That's significant.
It is. And their reach is quite something. Active in over 70 countries, accredited more than 1,000 programs.
Wow.
And the fact they offer their standards in so many languages: Chinese, French, German, Korean, Japanese, Polish, Spanish.
That really shows a commitment to being global, doesn't it? Making it accessible.
It does. It's about collaboration, sharing best practices internationally.
And it seems it's more than just getting a certificate for the wall.
Oh, definitely.
The feedback from healthcare leaders who've gone through JCI accreditation is quite revealing. People from Hong Kong Adventist hospitals, Burjdale Farha Hospital, they talk about tangible benefits.
Like what specifically?
Well, things like fostering better teamwork, getting different medical teams communicating more effectively. That came up a lot.
That makes sense. The process itself forces collaboration.
Exactly. And other leaders mention it being a catalyst for improving risk management.
Identifying potential problems before they happen.
Right. Building confidence in the community, too. And just instilling this culture of always looking for ways to improve, a continuous commitment.
So it really pushes organizations internally. It's not just about ticking boxes for an external body.
Precisely. Now let's zoom in a bit to India. You mentioned NABH.
Yes, the National Accreditation Board for Hospitals and Healthcare Providers. They're part of the Quality Council of India.
And their focus is specifically on setting up and running accreditation programs within India.
That's right. Their goal is to establish benchmarks that really drive the Indian healthcare industry forward, always keeping, the patient or consumer needs front and center.
So it's accreditation tailored to the national context.
Exactly. It allows them to address the specific challenges, the opportunities within the Indian healthcare system, which makes the standards more relevant, more impactful for providers there.
And navigating that process, getting NABH accreditation, can be complex, I imagine.
It can be, which is where organizations like QIinPediatrics Consultancy come in.
Right. You mentioned them. They help hospitals with this.
Yeah, it's part of their broader services. They help with hospital development right from the planning stages through to operations. And a key part of that is assisting with achieving NABH accreditation. They bring expertise in actually setting up quality management systems.
So it shows there's a whole ecosystem, really.
Yep.
The standard setters like JCI and NEBH.
Defining what good looks like.
And then consultancies offering the practical help to actually get there.
Which brings us nicely to the why and how of quality improvement, especially when we think about kids.
Yes, let's pivot to that. Because when we're talking about children's health, the stakes feel even higher. Why is QI so critical in pediatrics?
That's the core question, isn't it? And the sources we looked at, like the Pediatric Quality Improvement Essentials document and some of those podcast clips, really highlight this.
So what's the essence of pediatric QI?
At its heart, it's about ensuring the care children receive is consistently safe, timely, effective, equitable, and really centered on the child and their family. Not just good enough, but the best possible care.
And the reasons it's so vital are quite specific to kids, aren't they?
Absolutely. Think about a child's body, their brain. It's all still developing.
So errors can have much longer-lasting consequences.
Precisely. Communication is different, too, talking with a young child, involving parents effectively. Medication dosing is another big one.
Right. Often based on weight, tiny adjustments needed, more room for error.
Exactly. And you need care that genuinely involves the family, supports them. Plus, there could just be a lot of variation in how pediatric conditions are treated from place to place.
So QI tries to standardize the best approaches.
It aims to reduce harmful variation, yes. Children aren't just miniature adults. Their physiology, their developmental stages, they demand a tailored approach to quality and safety.
The Pediatric Quality Improvement Essentials laid out some core pillars for this, right?
Yes, it did. Safety is number one, preventing harm. Things like infections, medication errors.
Okay.
Then effectiveness, making sure treatments are based on solid evidence, best practices.
Makes sense.
Timeliness, catching problems early, starting treatment quickly. That's crucial for kids.
Definitely.
Then, family and child-centeredness. That means shared decision-making, age-appropriate communication.
Involving everyone.
Yes. And finally, equity. Really working to make sure all children get the same high-quality care, regardless of their background or circumstances, reducing those disparities.
That's a powerful framework. Safety, effectiveness, timeliness, family-centeredness, equity.
It provides a really solid foundation. And what's interesting is how these principles get put into practice. There are systematic methods.
Like the PDSA cycle.
Yeah.
Plan, Do, Study, Act.
Exactly. Dr. Ravi Sharma, in that podcast excerpt, explained it really well. It's this continuous loop.
Right. Identify a problem.
Plan a change you think might help.
Try it out, but small scale first.
Yes. Do it small. Then study the results. Did it work? What happened?
And based on that study, you act. You either adopt the change more widely, adapt it, or maybe even abandon it if it didn't help.
His example about reducing hypothermia in newborns' low body temperature really illustrated that cycle.
Right.
Testing changes to warming practices, measuring the impact, refining the approach.
That iterative process seems key. But he also mentioned a potential pitfall.
Yes, sometimes the study part gets shortchanged. Teams might jump to implementing something without really analyzing if the change they made was truly the reason for any improvement, or if it was beneficial at all.
So that data-driven, reflective step is crucial.
Absolutely. It's about learning and adapting constantly. Healthcare isn't static. So what does this look like in practice? Any concrete examples?
Oh, definitely. Some really high-impact projects came up. Kangaroo Mother Care KMC for newborns.
Skin-to-skin contact?
Exactly. APSE's Delhi scaled this up significantly, and the results were impressive, better compliance, reduced mortality in preterm infants.
Wow, that's huge.
Yeah. Another one is using digital tracking for immunizations, making sure kids get their shots on time.
Much more reliable than paper records, I imagine.
For sure. And asthma action plans in the ER. There was a collaborative led by Cincinnati Children's Hospital.
What did they find?
They saw reductions in repeat ER visits, and kids actually got better at using their inhalers correctly. Simple intervention, big impact.
That's quality improvement in action.
Other examples too, malnutrition screening, making sure that happens routinely. Using non-drug methods for pain management where possible.
Important, especially with concerns about opioids.
Right. Antibiotic stewardship, using antibiotics wisely, and developmental surveillance, tracking milestones.
It covers such a broad range of pediatric care. And how do they measure success? Are there specific indicators?
Yes, quite a few key pediatric QI indicators. Things like vaccination coverage rates, obviously, neonatal mortality rate,
Critical ones.
medication error rate, and the goal there is 0, always. How quickly pediatric sepsis is recognized and treated.
Time is brain, time is life in sepsis.
Exactly. Growth monitoring rates. Parent satisfaction scores how families feel about the care and rates at exclusive breastfeeding for infants.
Those give you a dashboard, essentially, of how well a pediatric service is performing on key quality aspects.
And the field isn't standing still. There are new tools being developed all the time to support this.
Like what sort of tools? Technology playing a role.
Definitely. Things like pediatric early warning scores, PUWS. These help nurses and doctors spot kids who might be deteriorating, catch problems earlier.
Okay, like a standardized way to assess risk.
Yeah. And growth monitoring apps, making it easier for parents and clinicians to track development. AI-powered tools are emerging too.
For what?
Helping calculate complex pediatric medication doses, for instance, reducing the chance of human error.
That could be very powerful.
Digital vaccination tracking systems, like India's QIIN platform, are another example, improving coverage, providing reminders.
Making the system smarter.
And even things like interactive dashboards for families to see progress, or using gamified learning tools to teach kids about their condition or treatment.
So technology is really being harnessed to improve data, communication, decision-making.
Exactly. Huge potential there. But putting all this into practice, implementing QI, it's not always straightforward, especially in pediatrics.
But you mentioned some challenges earlier.
Yeah, just the sheer range of ages and developmental stages in kids. What works for a toddler won't work for a teen.
You need very tailored approaches.
And that communication piece, effectively engaging both the child appropriately for their age and the parents or caregivers, that's vital.
A skill in itself.
And the fact that errors, even if they're rare, can be so catastrophic. The margin for error feels smaller.
Which means the culture around safety and quality has to be incredibly strong.
Absolutely. And Dr. Sharma had some really good points on building that sustainable culture of quality.
What did he emphasize?
Leadership buy-in was number one. Leaders have to champion it, provide resources.
Sets the tone from the top.
Totally. Having multidisciplinary teams, doctors, nurses, pharmacists, therapists, even families sometimes working together.
Bringing different perspectives.
Yep. Ongoing training and mentorship so people have the skills and support to do QI work.
Building capacity.
And importantly, celebrating the wins. Acknowledging progress, even small steps to keep momentum going.
Recognizing effort and success.
And finally, data transparency. Making performance visible so everyone understands where things stand and where improvement is needed.
That culture piece sounds absolutely fundamental, but it doesn't happen in a vacuum, right? You mentioned global organizations supporting this.
Exactly. Which brings us to ISQA, the International Society for Quality in Healthcare.
Okay, tell me about them.
They're a nonprofit, member-based organization, been around for over 30 years, members in more than 70 countries. Their whole focus is promoting quality improvement in healthcare globally.
How do you do that?
Through various means. Education programs, sharing best practices and knowledge, offering external evaluation services like accrediting the accreditors in some cases, and generally supporting health systems in their QI efforts.
So they're like a global hub for quality improvement, connecting people and ideas.
That's a good way to put it. They foster that international network and collaboration. And actually, they have their big conference coming up, the 41st International Conference.
Oh, yeah. Where's that?
São Paulo, Brazil, in October 2025. And the theme really ties into what we've been discussing.
What's the theme?
Inclusive health systems, navigating challenges with technology and humanity.
Technology and humanity. That really captures the current landscape, doesn't it? Especially in QI.
It really does. It points towards the future directions, too. We're seeing that growing use of digital tools in pediatric QI.
The AI dashboards, the apps you mentioned, predictive analytics maybe.
Yeah, tools to anticipate problems, and also that growing emphasis on equity, making sure technology and improvements benefit all children.
Addressing those disparities we talked about, that's critical. And it seems there's also a growing recognition that investing in quality makes good strategic sense.
Absolutely. It's not just a cost center, which connects to the Suprematic Healthcare Investment Collaboration idea.
Right. They offer support for healthcare ventures.
Yeah, and interestingly, they're willing to take an equity stake as their fee. They help with hospital planning, recruitment, setting up infrastructure, even the NABH accreditation piece we discussed.
So they're literally investing in quality from the ground up.
Exactly. It shows how quality improvement is becoming embedded right into the business and development side of healthcare. It's seen as fundamental to success.
That's a significant shift. It reflects this understanding that better quality leads to better outcomes, yes, but also contributes to the overall health and sustainability of the healthcare organization itself.
So as we kind of wrap up this deep dive, what's the big picture takeaway?
Well, I think it's clear that quality improvement and accreditation aren't just, bureaucratic exercises. They are vital, ongoing processes,
Especially in pediatrics.
especially in pediatrics, given the unique vulnerabilities and the long-term impact of care. These efforts, whether driven by global bodies like JCI or ISQA, or national ones like NABH,
Or implemented through systematic methods like PDSA cycles.
they're all pulling in the same direction, towards safer, more effective, and more equitable healthcare for kids.
And it's important to remember, isn't it, that sometimes it's the small changes, the consistent application of data-driven improvements that add up to make a really big difference.
Absolutely. Those incremental gains can transform outcomes and experiences for children and their families.
Which brings us to maybe a final thought for you, our listeners. Think about how these principles, continuous evaluation, adaptation, setting standards, learning from data, how they might apply beyond just healthcare.
Right. In any complex system, really.
Yeah. Whether it's education or technology or community projects, how could the ideas of quality improvement help achieve better outcomes?
Maybe consider the organizations in your own communities or fields. Are there ones clearly committed to these principles of continuous learning and improvement? How might you recognize or even support those efforts? Something to think about.